Thank you for joining us for this edition of Mental Health Pathfinders. I'm your host, Erin Connors. Climate change and mental health is the topic of today's podcast, and I would like to welcome our guest, Dr. Jacob Lee. He is a child and adolescent psychiatrist based in Honolulu, Hawaii, and he's also chair of the APA's Committee on Climate Change and Mental Health. Dr. Lee, thanks for being here today.
Thanks for having me, Erin. It's great to be here.
Let's dive right in. I think when most people think about climate change, mental health may not always be the first thing that comes to mind. Why is it so important to bring mental health into this conversation?
Yeah, absolutely. So as we're seeing the number of these billion-dollar weather disasters rising year over year, Americans around the country are experiencing natural disasters that are more frequent and more severe. And if you look at one type of those disasters, say hurricanes, which are happening off-season or are happening with unusual power, if somebody sees gale force winds physically harm someone, it's really easy to understand that cause and effect. But there's lots of ways that disasters can affect Americans in ways that just might not be as obvious. But I will say increasingly people are noticing and are concerned about the mental health impacts. In 2022, there was high-quality polling performed by Morning Consult and the APA that found over half of Americans 18 to 45 already believe that climate change impacts their mental health.
Yeah. And we did some updated polling numbers this year. And it's the same thing. Over 55% of adults say they believe climate change is impacting mental health. And, one thing I really found interesting about this poll this year is that there's clear generational and parental divides in these perceptions on climate change and mental health. The younger adults, as you mentioned, are obviously significantly more aware and impacted compared to those 65 and older. They understand the consequences of climate change and they feel personally affected. Similar, parents over non-parents are feeling it too. What do you attribute this to?
Yeah, well, if you look at polling from across both the global north and the global south, we see widespread reporting that young people are more concerned about climate change. And of course, there's a part that they simply have more exposure to these risks. If the risk will be higher in 2030 and higher still in 2040, they're going to spend more time and have more of their formative years during that time. We also know that there's widespread consumption of frightening, alarmist media. Grist magazine called Climate Change the social media story of the year. I believe that was 2019. We know that these topics have been really on the mind, and really the exposure to climate-related disasters, either in person or over social media, we found to increase people's level of stress. And really the amount of young people that are exposed to some climate-related disasters over social media, it's reaching almost 100%. I mean, there's total widespread dissemination about this information. It's a topic that's really on the minds of so many young people.
Yeah, and it has to be because we're seeing it on TV right now with the situation in Texas, with the flooding. What do you think are some of the most common or concerning mental health impacts you've seen associated with climate-related events?
Yeah, to maybe stick with hurricanes for a minute, because we're sort of in that season, we can look at like Hurricane Katrina. So, after Katrina, we saw many survivors develop serious mental illness. So we saw rises in conditions like trauma-related disorders, anxiety, or depression. And in the Katrina example, we saw suicidal ideation and suicidal planning more than doubled. And that's kind of a pattern we see across a variety of other disasters that are becoming more frequent. So in addition to those obvious physical injuries, many climate-related disasters are going to cause forced migration, which the United Nations forecasts to be about 20 million plus people every year related to climate disasters. We also see disrupted family roles or families that are physically separated. And unfortunately, this can even lead to a rise in things like domestic violence, which we might not, immediately come to mind when we're thinking of these topics. And just one other important thing I'd add, as mental health providers, as psychiatrists, we often think about the care of our patients. But taking a look at, say, the 2004 Florida hurricane season, we can really tell there's lots of significant impact on the health workers themselves. So like in the 2004 Florida hurricane season, we saw this horrible, unprecedented season with 4 hurricanes and 1 tropical storm. It cost like $5 billion in damage. But the workers, the state and local public health workers who were first responders there, after the disaster, they had more post-traumatic stress disorder, more depression, were 3 times more likely to report cigarette and alcohol abuse. So it's not just affecting our patients; it's also affecting the providers ourselves.
And that makes a lot of sense. And your committee is so important. It's at the intersection of science, advocacy, and clinical care. What kinds of projects or priorities are you currently focused on with this committee?
Yeah, there's a reason that the World Health Organization calls climate change the greatest threat to health in the 21st century. Because of the scale of this climate crisis, which we sometimes call the poly crisis, efforts to protect our patients really require a multi pronged approach, which is how the committee has been working on this. And there's certainly an advocacy element because of the power that the state or federal government can bring to bear on solving these issues. So the APA has, for instance, recently supported the Community Mental Wellness and Resilience Act, which we can talk about a little bit more, but works to build community level resilience before and after natural disasters. And as the government pulls back on funding for research, our committee has been encouraging the APA's Council on Advocacy and Government Relations to support sustainability and science research across federal, state, and grassroots levels. The committee is also working to add a Z code to describe climate related distress. And that's part of our balancing act. We're trying to strike between not pathologizing rational climate distress, but with recognition that having a diagnostic code is so important in our current system for people to get the services they need and for
Yeah.
physicians and public health workers to track the growing prevalence of these kind of conditions.
Yeah, let's focus in on the clinical aspect of this too. What can individual psychiatrists do to raise awareness about the connection between climate change and mental health among their colleagues and actually within their communities too?
Yeah. So first up, psychiatrists, mental health workers should just ask themselves what they know about climate change and mental health. And there's no need to reinvent the wheel here. Many have lots to learn about this newer topic of research, and I would point them towards the committee and other organizations have had multiple talks at every APA annual meeting the past several years to kind of increase that education and important APA webinars like Climate 101 or webinars with specific focuses like climate refugees or indigenous peoples or psychological impact. So I'd recommend clinicians start there to make sure they have the appropriate knowledge base to, approach this topic with that background. The psychiatrists are well positioned to share accurate climate related messages, either messages from the APA or messages the APA has developed in partnership with groups like the Climate Psychiatry Alliance or American Public Health Association. Easy to access resources, including the APA's Instagram page or other social media, are an easy starting point. Those who feel that they've reached a higher level of expertise may wish to give grand rounds or informative talks at their facilities, may wish to testify before their state or even federal government. And, just important to think that psychiatrists are really uniquely well positioned because we understand both resilience factors and we understand how different groups might be disproportionately affected, by these rising and more frequent disasters.
So should this be part of a regular conversation with your patients? Is this a question that psychiatrists should be asking? Maybe all doctors should be asking their patients if they're feeling a little uneasy.
Yeah, I think, it's really important that, at baseline, we're providing the same kind of services we're providing to other patients. We're understanding their story. We're trying to understand traumatic events that they've, experienced and help them with developing healthy coping strategies. And as necessary, we'll diagnose and treat any mental illnesses because this is a frequent type of trauma that people are exposed to. And because these are only becoming more and more prevalent in our communities, it certainly should be a consideration in most psychiatric intakes. And as we go forward, I think the importance of that conversation will only grow.
Yeah. And from a systems perspective, how can the field of psychiatry prepare for and respond to the increasing mental health demands brought on by climate related stressors?
Absolutely. Well, so again, to point back to the APA's recent support for the Community Mental Wellness and Resilience Act, which, just to mention it, would fund a CDC grant program to try and build community level resilience for before and after natural disasters. This speaks to the fact that when there is a disaster, the needs in a community can raise very quickly, and that might overwhelm health systems as they already exist. So that might I might point providers in that situation to tap into existing resources like the government's ready.gov program or SAMHSA's Disaster Technical Assistance Center. Those are kind of pre-built tools that providers can easily use to expand their reach, especially as these services become maybe overwhelmed and the follow-up of important disasters.
Right. And finally, what gives you hope as you look to the future of mental health in a changing climate? And how can our listeners get involved or even stay engaged with this issue?
Yeah, so I'll say the American Psychiatric Association has a caucus for interested psychiatrists and other mental health workers to follow, receive email updates, and hear the latest in the space. In a culture where many feel atomized and lonely, everything that I've read shows that community holds the key. We as patients and as communities can't face a challenge this large without a support network. And because so many people already have a negativity bias, it's easy to feel like nobody is out there working. But, as Mr. Rogers says, look for the helpers, right? There's many people in our communities that are cleaning, that are working towards sustainability, and to tap into those networks can both be inspiring and help give us a more accurate picture about how many people already care and are already working to make the future a more sustainable and healthy place.
Is there anything else you'd like to add before we go?
Yeah, one of the big things that I think is important is that the practice of medicine is a polluting industry. American healthcare produces 8% of our country's greenhouse gases. The practice of healthcare is directly harming people. And as we look to reduce our own harms, we can look to successes other places, like England's National Health Service, the largest employer in Europe and the largest single-payer healthcare system in the world. They've been working to reduce their pollution and have been very successful while still delivering high-quality care. And in 2020, they announced their commitment to become the world's first net zero health system. I think that's a model that American healthcare and especially American psychiatry is well positioned to follow. And I think that gives psychiatry a real chance to be a leader in sustainable practice of medicine.
Absolutely. This has been a fascinating discussion. Dr. Jacob Lee, thanks so much for joining us today.
Thank you so much for having me.
And for our audience, you can always find Mental Health Pathfinders on your favorite podcast platform.